Hello, I'm Regina Jackson, Interim CEO at the Center for Environmental Health. Welcome to our virtual town hall, Meals That Heal, Bridging the Gap of Food Inequities at School. CEH is a nonprofit. It's dedicated to protecting people from toxic chemicals using science, policy, litigation, and purchasing power to create real, tangible wins for public health. You can support our work by texting GIVE, G-I-V-E, to 510-288-3065, or by going to ceh.org/donate. Thank you to our speakers today. Dr. Kristine Madsen is a professor at Berkeley Public Health and director of graduate certificates in food systems. Thomas Galligan, principal scientist, food additives and supplements for the National Center for Science in the Public Interest. Sue Shang, director of the food program at CEH. Annalisa Belliss, senior program services specialist at StopWaste. During the town hall, please feel free to ask questions via this chat, and we will gather them for the Q&A portion. Please use the hashtag CEH Town Hall when tweeting about this event. This town hall is being recorded and will be posted on our website tomorrow. All right, are we ready to get started? I think we are. Across the United States, schools are going back to basics in the lunchroom, serving healthier food on safer foodware. Meet some of the change makers fighting against systemic problems like food insecurity, toxic chemicals in foodware, and food waste during this lively town hall. Our first speaker is Dr. Kristine Madsen, a professor at UC Berkeley School of Public Health. She is a pediatrician and research scientist with expertise in the design and evaluation of interventions related to the cardiovascular risk in youth and health inequities. Her research is focused on identifying policies and programs that will improve the food system and reduce health inequities. She has worked with hundreds of schools to improve their nutrition and physical activity environments, and has partnered with health departments, nonprofits, and cities to expand the reach of effective public health interventions. She's also really cool, people. Take it away, Chris.
Thank you, Regina. It's been far too long since I've seen you, but Regina is a dear friend and colleague of many years. I'm going to talk just a little bit about school food in general, since I think that's going to be a focus of our town hall today. So over the last 50 years, there's been an unprecedented increase in diabetes. And as a pediatrician sitting in clinic, I was, worrying about how to keep my kids healthy, but I knew that really the biggest risk was just around the corner because they were so much more likely to develop diabetes and cardiovascular disease than their parents were. And I also knew from an equity standpoint that diabetes is not spread evenly across society. These, epidemics actually are far more likely to occur in low-income communities. So rather than just waiting in clinic, I began to feel like I wanted to address upstream drivers of these inequities and of these, major problems in health. And one of the key areas for change is the food environment. So we think we may have a lot of choice because when we walk into a grocery store, there's tons of different brands, but honestly, almost everything you see in grocery stores is owned by about 1 of 10 companies, which means we have much less choice than we think we do. And we don't have many options of supporting local businesses. It also, you've all seen that portion sizes have increased dramatically over the last 50 years, and ultra-processed food is kind of everywhere. So if we're thinking about where, as a society, we might intervene on the food environment for children, one of the key places to look at is schools. They spend a ton of their time there, and it's certainly a place that we want to make sure that the nutrition environment is safe and healthy. So the National School Lunch Program, which is key, was actually the result of decades of advocacy. There were activists on the ground who wanted to make sure that kids had healthy meals, and particularly after the Depression, when so few families had money for enough food on their table, the National School Lunch Program took off, and that was in 1946 under Truman. The school breakfast program followed, and interestingly, one of the key drivers was actually the Black Panthers organization. They, in Oakland, started free school breakfast for kids. I think this photo actually comes from a Kansas City chapter of the Black Panthers, but they recognized that in order for kids to be able to be ready to learn when they showed up at school, they needed a healthy breakfast. I would encourage you to look into the history of this, because basically through violence and oppression, this movement was ended, which Regina and I have had conversations about, as Regina has taught me a lot about the local history. And I think the key, though, is that there are a lot of people who get that to have a healthy nation, we need healthy kids who are, able to concentrate and focus in school and ready to learn. So in 1975, school breakfast started, and today we serve through these programs about 30 million lunches a day and 15 million breakfasts. And if we think about equity, this is great. It's amazing that we're able to provide the meals to this many kids. But if we think about equity, the question is, so who's getting those meals? And any student can buy a meal at school. But in terms of free meals or reduced price meals, eligibility is based on family income, and free meals and income up to $36,000 for a family of 4 means a child would be eligible for a free meal, and incomes up to $51,000 for reduced price meals. This is all tied to the federal poverty level, which, by the way, these amounts are the same across all the 48 contiguous states, even though cost of living is dramatically different across those arenas. And so one of the problems from both a school perspective and a family perspective is that becoming eligible, actually demonstrating your eligibility, can be quite complicated, very burdensome to schools. And there's actually a lot of stigma where it's sort of this separation between the haves and the have-nots in terms of who's eating school meals, right? So advocates have continued to fight, and one of the things that they were able to achieve was something called the Community Eligibility Provision, or CEP, which many of you have heard of. But basically what this said is a low-income school can feed free meals to every student, and the government reimburses for that. And so this was both an idea that would increase meals in general for kids, reduce the burden on schools in terms of administrative stuff, and also reduce stigma so that everybody was just able to eat healthy meals. In COVID, our response to COVID, because we have all this infrastructure in place to feed meals to multiple children, we were able to rapidly address many of the needs and food insecurity that was happening through COVID. The USDA very quickly changed its rules, allowing schools across the board, regardless of whether or not they were a low-income school, to provide meals to any child in need, including through the summer, which was incredibly helpful in reducing the burden of COVID on families. And there have been a few states, California is one of them, that actually have created now universal meals so that all schools can continue despite, COVID. After COVID, the rules have changed again. But in California, Maine, and Vermont, all schools can be reimbursed for serving free meals to all kids. So these are huge wins in terms of equity and access. I think one of the issues is what's in those meals. So on the left, we see a meal from the 1960s, and on the right, this was early 2000s. And meals in school were not looking great, but we did pass the Healthy Hunger-Free Kids Act in 2010, which meant that all meals had to actually comply with USDA guidelines. We had to serve more fruits and vegetables. And again, I think this is creating greater equity because what's being served in schools is now healthier, although I think Thomas is going to give us more details on some of the other issues around the content of school meals. The other thing I want to touch on is just that school meals are big business. So schools spend $20 billion annually on lunch and breakfast programs, including summer meals. And this means that how they spend their money matters, right? So it matters locally because this is farm to school programs, which are one of the things that we study, are important because it means that those big procurement dollars can actually go to local companies, but it's not just about who you're buying from. It's not just about nutrition. It actually matters too for the planet because we know that our food system contributes at least a quarter of all greenhouse gas emissions. So not just what you buy, but what's wasted matters. And I know Annalisa is going to talk about that. And also the packaging. So how schools choose to use that money, because we know that things like pollution and food waste and climate change also are going to affect low-income communities much more so than higher-income communities. So all of these things kind of come back to equity. And with that, I'll close just to say that we've done a lot of work looking at ways to increase uptake of school meals, to ensure that those meals are healthy. And now we're looking at ways to actually decrease waste. And I'm excited to be working with CEH and with StopWaste on a study that's coming up this spring. So I'll turn it back to Regina. Thanks so much.
Wow, Chris, $20 billion. That is just incredible. Thank you for all of that history. Thank you for your expertise in that space. So now that we know the landscape policies and programs to improve food systems and reduce health inequities, let's talk about food itself. What's in those school lunches and how do we improve them? Our next speaker is Thomas Galligan, Principal Scientist, Food Additives and Supplements at the National Center for Science in the Public Interest, who works to improve the regulation of food chemicals and get unsafe chemicals out of our food supply. We appreciate you, Thomas. Welcome.
Thank you so very much for having me. I'm excited to be here and to share some of the work that I'm doing at CSPI and the work that we're trying to do to make our food system and the school foods that our children eat every day safer and healthier. So for those who may not be terribly familiar with CSPI, we are a national nonprofit that advocates for a safer, healthier, more sustainable, more equitable food system. And the way that I work on that is by advocating, like we just heard, to get harmful chemicals out of our food. Are you all seeing my screen? Just to hear?
Yes.
Okay, great. So I'm going to talk at a high level about our food and the chemicals in our food, because there's basically there's that CSPI is trying to solve when it comes to the chemicals in our food. And the first is the unfortunate reality that there are in fact harmful chemicals in our food. And those and aspartame, those that are used in food packaging like phthalates and PFAS, and those that might end up there through environmental contamination like toxic heavy metals and also PFAS. The other issue is that there's a transparency crisis when it comes to the chemicals in our food. We don't actually know what's in our food, and in some cases, neither does the FDA. And that's because there are legal loopholes that allow the food industry to introduce novel, untested food chemicals into the food supply without any oversight from FDA. They do this by declaring a chemical as generally recognized as safe or GRAS. And when they do this, they can introduce it to the food supply without FDA approval, and they don't even have to tell FDA that they made these determinations. So we then compound that issue with the fact that many ingredients in our food do not have to be labeled by name. So things like artificial color, artificial flavor, natural flavor, all of these things are super vague, and we don't actually know what's in our food. And we're left with a situation in which the only people who really know concretely what is in our food is the people that are making it, the people that stand to make money from selling it to us. And so the consequences of these policy and market failures is that consumers are being exposed to harmful chemicals through their diet, and that includes children eating school foods. Consumers also potentially misunderstand the state of our food chemical system, having more trust and more faith than probably they ought to, knowing that there are loopholes that allow industry to bypass FDA approval. And ultimately, consumers bear the dedicate the time and have to have the knowledge to do this. So that would be like having to screen every food you buy at the store, the ingredient list of every food you buy for a harmful chemical. But that doesn't allow you to capture the chemicals that are in the food packaging or the chemicals that are there through environmental contamination. So even when you do make the effort and you have the privilege to take that time and make the effort, you still left with a situation where consumers do not have the ability to be free from exposure to harmful chemicals in their food. We think this is an unfair, unreasonable burden to place on consumers. That burden should be borne by our policymakers and by industry. So what are the root causes? Why a good bit of the blame will fall on FDA, the Food and Drug Administration. This is the federal agency that is ultimately responsible for ensuring that these chemicals that are in our foods are safe. So why aren't they doing that? Well, it could be that they have limited resources. In certain situations, they lack motivation, and there are structural and cultural problems within the fabric and function of FDA that seem to undermine its ability or interest in performing this essential duty that it's charged with. We can also place some of the blame on Congress. They, as the political entity that gives FDA its authority and its resources, have the responsibility to ensure that FDA is doing its job effectively. And so if we're not seeing change at FDA, we can also point the finger at Congress. And the lack of change at Congress could be due to a lack of political will and the fact that they bend to lobbying from industry, who ultimately has a vested interest in ensuring the status quo remains, because they are going to protect their bottom line. They are in business to make money. And so they will, if comes to shove, from time to time, prioritize profit over public health. And that's a broad stroke. That's a broad brush. I'm sure that there are good actors within industry and there are bad actors within industry, but generally speaking, they're there to make money. States and localities can also bear some of the blame here. There are ways that states and cities and counties can get involved in protecting consumers from harmful chemicals. And so just like at the higher levels, there are limited resources for these entities. There could be a lack of political will. And in these particular cases, there could be a lack of familiarity and expertise. So CSPI and CEH and other allied organizations that we work closely with are trying to work at each of these levels to solve these problems, to get these harmful chemicals out of our food and make sure that there's greater transparency and greater oversight. And one particular area I wanted to focus on is on synthetic food dyes, because this has particular tie-in to children's health and school foods. So in 2021, the California Office of Environmental Health Hazard Assessment came out with a massive systematic review of the evidence linking synthetic food dyes to behavioral problems in kids. And what they said was that these dyes, the number dyes like red 40 and yellow 5, can cause or exacerbate neurobehavioral problems in some children. And that at a minimum, in the short term, these effects should be acknowledged and steps should be taken to reduce children's exposures to those dyes. What we've seen since then is a lack of action in California or federally. And so we are now working to solve that. And one dye in particular has an entirely separate issue we're talking about, and that is red 3. Back in 1990, FDA itself determined that red 3 causes cancer when consumed by animals. As a result of that conclusion, they banned its use in cosmetics and topical drugs, but bafflingly never banned it in food. They said they were going to, but they never did. So what are we doing about it? For all synthetic dyes, we have recently submitted a petition to the California Department of Public Health asking that they require foods containing these dyes to have a warning label on them. And CDPH, the Department of Public Health, has actually scheduled a hearing about this on April 11th, so just less than a month away. It is open to the public, and written comments are being accepted until May 12th. So if you are in California, I would encourage you to please attend and submit comments and let your voice be heard, because the only way we get change is by being vocal and demanding change. For red 3, we've submitted a petition to FDA asking them to finally ban the use of red 3 in food, and CEH joined this petition. The comment period for that petition is open until April 18th. So again, anybody here in the US, go and submit comments and ask to buy out of our food. broadly speaking, if you're interested in the work that CSPI is doing, please come check us out at cspinet.org and sign up for action alerts. We have a lot of really helpful resources like chemical cuisine. We have some reports on school meals and school milk. And CSPI also collaborates on what's called the Ingredient Guide for Better School Food Purchasing, which has some more information about the chemicals that might be found in school foods and how those who are purchasing school foods can make better choices for their students. So thank you very much.
Wow, Thomas. I mean, profit over public health. I thought as a consumer that when I spent my money, I was actually getting what I thought I was purchasing. The FDA's got a lot to answer for. So April 11th, people, let's make sure that we register and we go. Thank you so much, Thomas. Now, let's travel from the food to the foodware. CEH's food program aims to build a world worth aspiring to, where disposable foodware no longer contains toxic ingredients like PFAS or styrene. And as a whole, disposables diminish their prominence in our lives and in our landfills. Over the last 4 years, CEH has become a leader in providing scientific and procurement advice on healthier, environmentally preferable foodware options. I want to say that again. Over the last 4 years, CEH has become a leader in providing scientific and procurement advice on healthier, environmentally preferable foodware options. By creating resources like the Green Screen Certified Standard for Food Serviceware and the Ditching Disposables Toolkit for K-12 schools, our work is transforming the $19 billion global food service disposable market. At the helm of CEH's food program is none other than Sue Chang, who works with institutional purchasers from a wide range of sectors to harness their collective buying power to eliminate the use of harmful chemicals and expand the market for environmentally preferable products. Her current focus is on hormone disrupting chemicals in consumer products, particularly in food and food packaging. Welcome, Sue.
Thank you, Regina. I'm going to put my screen share, so hopefully everyone can see that. Thank you, Regina. So, hello, everyone. I'm really excited to be here as part of what constitutes a healthy meal. We need to not only look at what food is being served, but also at what our food is being served on and stored in. Unfortunately, this scene is what we too often see in schools and many restaurants around the country, the proliferation of single-use foodware, even when people are eating on site. The problem became even worse at the start of the pandemic when everyone was remote and most places turned to single-use takeout containers. I'll briefly touch on each of these 4 areas: waste, toxics, life cycle, and climate impacts, but we'll be placing more emphasis on the toxic chemicals because it's an issue that often has the least awareness and is often very difficult to access the information about. Many people have expressed concern about the significant increase in waste during the pandemic. An average school of 450 students serves roughly 81,000 meals per year. And cumulatively in the US, schools provide 5 billion meals to students annually. Many schools serve these meals on single-use foodware due to their convenience and low upfront costs. Unsurprisingly, this creates a lot of waste. So just imagine what's in one school's dumpsters every day and then what gets sent off for disposal from thousands of school sites across the country. And we often concentrate on the waste because we can visualize it, but there's a lot more to the story. The main point I would like to highlight today about toxic chemicals in everyday products, but especially in foodware, is just because it's legal doesn't mean that it's not hazardous. You already heard about from Thomas about the presence of chemicals in food, but most people would assume that foodware and food packaging do not contain toxic ingredients, and unfortunately that's not the case. Over 12,000 chemicals have been approved for use in production of food contact materials globally, and some of them are known to cause harm like cancer, birth defects, and impaired fertility. And most of these chemicals on the market haven't been thoroughly evaluated for their toxicity. Here are two examples of common disposable foodware products. Many of you may have been or may still be using expanded polystyrene foam, often referred to as styrofoam, the one on the top. And then the second product is a molded fiber clamshell, which is often made of sugarcane, bagasse, or wheat straw, or different kinds of plant fibers, which is often seen as eco-friendly, but unfortunately contains PFAS chemicals. If you haven't really heard of PFAS, I encourage you to look this group of chemicals up. They've been in the news a lot due to the growing concern about their widespread use and contamination of communities across the country. They're associated with a range of adverse health effects that you can see on the slide, and children are especially vulnerable to these toxic chemicals and can be exposed by handling or eating food that was served on products that contain them. For polystyrene, the main chemical building block to make these containers is styrene, which is a carcinogen and has been shown to leach out from the products and get into the food or beverage. And per and polyfluoroalkyl substances, or PFAS, are a class of man-made substances that have earned the nickname forever chemicals because they are so extraordinarily persistent in the environment and in our bodies. They're used to provide a grease and liquid-resistant barrier for paper and fiber foodware products. Unfortunately, studies have shown that exposure to PFAS has been found to lower the effectiveness of vaccines by reducing the effectiveness of our immune systems. CEH has heard from school district staff, teachers, and families from across the country who are alarmed by the growing amount of disposables in their schools, the toxic chemicals found in these products, and the impact that they have on our health and environment, which have only been compounded by the pandemic. We're concerned about the use of toxic ingredients in those products, and not just during the use phase, but about harm to people and our planet throughout their life cycle. Because we're talking about products that are used in massive quantities and have a very short lifespan, it is even more important that we take a holistic approach. So now that we're aware of PFAS and styrene and plant-based foam and plastic foodware, these are just two key ingredients that we happen to know about. The industry doesn't have to tell us what else is in there. Manufacturers may tell you that everything is FDA approved, but the reality is that doesn't really mean much, as you heard from Thomas, because FDA is under-resourced and isn't adequately protecting us in this area. We can't keep approaching this problem chemical by chemical. You all probably heard about BPA in water bottles years ago. Did you know that it was replaced by a similar chemical such as BPS that can have the same or worse health effects? One way to avoid this problem is to ask for foodware that is green screen certified. This certification requires the disclosure of everything that goes into making the product. It helps to identify products with preferred chemistry and doesn't allow companies to switch out one problematic chemical with a similar one, which we call a regrettable substitute. This is an important tool that can change the market and move us to a system where manufacturers understand what is going into their products and incentivizes them to choose safer chemicals. As far as climate, most single-use plastics are fossil fuel-based, made from petrochemicals. They contribute significantly to greenhouse gas emissions, starting from the raw materials through to production. And since many of these products are produced overseas in shipping, and then again at disposal if they're burned. The paper or fiber-based products don't provide much benefit when you spend extra money to buy compostable products and then don't have an industrial composting facility that will accept it. The certified compostable products are designed to break down in an industrial facility. So if you don't have that, they'll end up in a landfill where they'll break down and produce harmful methane emissions. Compostability on its own doesn't necessarily mean that a product is safe or more sustainable. If you do have a facility that accepts foodware, look for one of these two compostability labels when purchasing products and make sure that your facility will actually accept them. CEH is working with institutional purchasers across the country and especially K-12 schools to help them move to better foodware options with a heavy emphasis on reusables seen as a long-term solution. There's an organization that we partner with that I just wanted to highlight called Plastic Free Restaurants that will actually help schools buy reusables to replace single-use plastic or PFAS-containing foodware that the schools are currently using. And so you can, we'll follow up and send links to that group. And finally, we've created tools and a step-by-step guide that Regina had mentioned called our Ditching Disposables Toolkit to help school or school systems switch to healthier foodware options. It includes lessons, cost calculators, how-to guides on collecting and reporting data, engagement strategies, and more. CEH is helping schools around the country ditch disposables and normalize reuse while cultivating sustainable practices from an early age. And we're seeing really positive, wonderful results from the schools that have been piloting or making the switch. And we're really excited to be sharing this information with you all today. Thank you.
Sue, thank you so much. It sounds like green screen certification to the rescue. I am just outdone at all that we don't know about what's going on with our food. Now that we've learned about the landscape in the schools, the food and the foodware, I guess we now need to hear about the food waste. So we're going to welcome our next speaker, Annalisa Belliss, Senior Program Services Specialist at StopWaste. StopWaste is a government agency responsible for assisting businesses, schools, and the general public in Alameda County of California with waste reduction and initiatives and education. She has supported several school districts in the Bay Area with implementing food waste tracking, prevention, and recovery programs over the last 6 years. Hats off to you, Annalisa.
Thank you, Regina. Good afternoon, everybody. I'm happy to be here today to talk about our work with schools. So I work for StopWaste, which is a government public agency representing 17 cities and sanitary districts in the Bay Area of California. And over the last several years, we've been working with schools to work on food waste reduction initiatives, including food share tables and food donation. So I'll just be talking a little bit about that today. But if any of you have ever been to a school or perhaps even remember in your youth when you were at schools, you might recall the enormous opportunity that there is to reduce food waste, and that food waste is somewhat inevitable when you're working with kids because of, tastes and as well as the different requirements that students now have to take a fruit or vegetable and so on, because we want to make sure that they're healthy, and fed and having nutritious meals, but sometimes it doesn't always work to get it in their stomachs. But as far as food waste goes, I'll just mention that food waste in landfills is actually a huge contributor to the climate crisis, because when food waste is buried in a landfill, it contributes to creating methane, which is a greenhouse gas that is actually far more potent in the atmosphere at trapping heat than carbon dioxide. So it's really essential for us as a society to work on reducing our food waste. And if we do have food waste, making sure to put it in the commercial composting facility or compost bins or school gardens where it can break down instead of putting it in landfills. And kind of going forward here, just to give you a visual of what food waste actually could look like in a school. It could look like, of course, the plate waste that comes off of a student's plate or maybe a half-eaten apple. But based on these pictures, this is actually a lot of food that was actually recovered through a food donation program that one school that we work with here in the Bay Area had been tracking. They started a food donation program and even had their students involved to help collect surplus meals from the food share table. So a lot of these are items that students actually selected from the food line and for whatever reason didn't actually consume, placed it on a food share station or table, which made it available for other students to take if they wanted. But then at the end of the lunch service, there was leftover. And so the program actually collected what was left over, including what was surplus from the back of the kitchen that perhaps could not be reserved again, and then actually collected that and donated it to a local organization who could then distribute it to folks in need. But by looking at this picture, you could see that a lot of this food is perfectly good, totally good for human consumption. And just to give you a sense of the amount, this one elementary, K-5 elementary school collected almost 3,000 pounds of surplus school food to donate through one school year. And this is actually, I think, the first school year after coming back from the pandemic and being remote, where things are still a little fuzzy with schools getting back on track with their regular programming. So there might even be more opportunities now that schools are kind of getting back in the swing of things. And I also just wanted to mention about what's kind of being done about this. So I mentioned, a practice called food share tables, which has actually been, it's been more and more common, I think, through schools, but I will say that it's sometimes challenging for schools to implement when they're having a lot of challenges with staffing and people and school staff and teachers and cafeteria workers being stretched emotionally and, with their time. But to talk about some of the laws that are actually trying to help support making sure that food doesn't go to waste. California actually passed a recent law called SB 1383 that requires a wide variety of food generators to donate their surplus food, and that also includes schools. So starting next January in 2024, schools in California will actually be required to donate any surplus food that is still eligible for human consumption to a nonprofit organization. And in this picture here, you can see this was actually at the district warehouse where we were working with the school district to help them donate their surplus food. And it was cases of carrots that were perfectly good, but for whatever reason, they just needed to be, they couldn't stay in the school storage area and had to be moved out. So that's just one effort. And just to clarify some questions, because I think this definitely comes up a lot in schools, especially even after COVID. Our environmental health department has greenlighted food share tables and food donation for schools, but I will emphasize that it's super important to always check with and engage your local environmental health department. In some cases, it might be your local health department, public health department, on what their recommendations and guidelines are for food donation, because it will vary depending on where you live and what your health inspectors are comfortable with. But for our county, what's okay to donate is hot entrees that were heated but not served and then cooled to a proper temperature, items that were left on the food share station at the end of a meal service that are unopened, unbitten, or otherwise intact. And to clarify, those are also items that are only served in the school meals, so not any yogurts or peanut butter sandwiches that were brought from the home, from a student's home, only school food. For health and allergy safety. And also lightly blemished fruits are also able to be shared. But something that can't be donated is any items that were not kept at the safe temperatures, which is kind of obvious, but anything that's not fit for human consumption because of time and temperature controls does not need to be donated. We have a couple resources that we produced for our county on food share tables and school food donation, but they may also be applicable to other school districts in the country as well. And we also have a series of food share videos, some that are educational for students and staff, and even one that was actually featuring some high school students talking about the food share table at their school and how they spruce it up to make it more noticeable for students to use. And I'll put a link to those in the chat in a little bit. And if you want to check out our resources for how to reduce school food waste, you can visit our website there, and I'm happy to answer any questions. Thank you.
Annalisa, that was quite a mouthful. I had no idea how much waste there was. But thank goodness you've identified for us what we ought to be looking for and the policies and state legislation that say nonprofits can receive it, because that means that there are going to be more resources available to the people that really need them. So thank you very, very much for that. Moving now to kicking off our discussion with the panel, we would actually love for each of you to answer this question. How would you define a meal that heals? If we could go in the order that you all spoke, Chris Madsen, Thomas, Sue, and Annalisa, that would be wonderful. Very excited to hear how you define that. How would you define a meal that heals? Chris?
Well, we didn't talk about this at all, but I think on the spectrum from just ensuring adequate nutrition to having meals that actually contribute to greater quality of life, we really have to talk about food sovereignty, where people are not just in charge, not just able to get the calories that they need, but they're able to support the businesses they want to support in getting to those calories, that they have a say in how their food is produced and what's produced. We're pretty far from that, but I would encourage those who are really interested in transforming the food system to look into food sovereignty rather than just food security.
Okay, that's excellent. Thank you very much. Thomas, did you want to join this?
Sure. Yeah. I mean, so at a bare minimum, it's got to be a meal that meets your nutritional needs, that promote health and a disease-free life. And that would also include being free from toxic exposures, of course. But that's just the bare minimum, right? We also have to consider the sustainable aspects of our food system, the equitable aspects of our food system, the feelings of the belonging and cultural identity that go with food and can promote healing and inclusion. So it can really balloon beyond just nutrition and chemicals, but that's the starting point, is nutrition and safe food chemicals.
Thanks, Thomas. That's rich. Sue?
Can I cheat? I'm going to say, like, building on both of what Chris and Thomas said, I think it's all of that. And I think what I'm excited about too, with the idea of having better foodware options, is that what we're seeing when schools are bringing reusables into their schools, it offers an opportunity for them to bring in more local, fresh options as well, less processed, less packaged food, foods that kids are excited about. And, we're seeing some schools bring in salad bars with the reusable trays, and kids get to pick among all these healthy options what they want to eat, and they're seeing less food waste. So I will turn it over to Annalisa.
Perfect.
Yeah. Thank you, Sue. I'll just jump in. Adding on to everything everyone said, I would also just, personally, as a slow eater myself, I would like to say that a meal that heals is one that actually gives space and time to enjoy the meal, so that you're able to consume it. Because I think we see that time and time again at schools, is that instruction time is prioritized over time for students to actually sit down and enjoy their meal, even in a quiet, calm setting. If you think about a school cafeteria with kids yelling and screaming and lots of chaos, that's not really the greatest environment to be appreciating and enjoying your food and actually seeing it as nutrients for your body. I've heard of some school principals actually taking the time in the lunchroom and actually reading a storybook to the students to help create that calm environment. And that's just one best practice that would be a great idea.
Outstanding. I love all the unique ways in which you've all captured meals that actually can heal. So thank you very much for that. As we are developing some of the questions for the panel from the audience, we do have a few to pose now. For Sue, if parents or teachers are interested in helping their schools move towards safer foodware or reusables, what are the steps they can take?
Well, we have our Ditching Disposables Toolkit, where we lay out a lot of the different issues and steps that parents and schools can take on making that transition to figuring out what the best foodware options are and how to get there. And we have a lot of great webinars as well that are online. But, first of all, I would say just by really, it can be anybody that can initiate something at the school. It could be a interested student. It could be a concerned parent. It could be a teacher. We're seeing all sorts of people step up as champions to make the change happen. And In addition, you can also contact us because we have a great team here. My colleague Ben Schleifer has been working really closely with schools and doing a fantastic job at getting people really excited and equipped with the tools to make that change happen.
Incredible. Thank you. So, Thomas, what other additives besides red dye should we look out for?
Oh, well, there's many to list. And I'll put the link to our chemical cuisine resource that sort of outlines CSPI's ratings of food additives. We rate things from safe to avoid, and I would say, luckily, most things we rate as safe, with just a handful of things that are important to avoid. The other big ones that I would point out would be aspartame, which is a artificial sweetener used in a lot of beverages. And then in the news a lot recently, it's been titanium dioxide, which is a pigment that's used to make foods bright and white and shiny. That's been linked to DNA damage.
Yikes. Okay, thank you very much for that. A little scary there. So for Annalisa, and I'm excited to figure out how I can get involved in the action. What can each of us do to reduce food waste?
Well, definitely everybody has a role to play in reducing food waste, whether it's at school or at home. If we have 3 meals a day, that's 3 opportunities to reduce food waste, whether it's at home and in cooking, or also encouraging those around us to do what we can to, prevent that waste, prevent the food from going to waste. But as far as schools, I have to say, I think something that has been coming up for me a lot in this work in terms of reducing school food waste is really trying to figure out how we can support our school food service workers, because they really are overburdened and underpaid, along with lots of other school staff. And it's really affecting the entire ecosystem of schools and what they're able to do to provide for our students. So I have to say that really trying to figure out how we can support our school staff is one of the biggest ways we can actually prevent waste, because if they don't have the capacity to do that, how can we achieve our goals together?
Really, really good point. Thank you very much for that. So this is for Thomas or for Sue. How bad is the situation with food takeout containers, considering that hot foods are put in disposable plastic boxes all the time? What are the impacts on human health with such practices?
I can start, and if Thomas, if you want to jump in. Yeah, I mean, it's a problem with the plastic containers. A lot of them just have so many different chemicals, and they're known to have these chemicals leach out from the containers and get into the food or beverage. We don't know what all the chemicals are that are in these products, so it's hard to say what the health effects will be. And it's really hard to link often, health effects directly to the particular foodware, but we know that these chemicals are associated with adverse health effects, and we know that they should not be regularly used for these food containers. I don't know if you want to add anything, Tom.
Well, yeah, you've covered it very well. I think I would just add that takeout containers are only one place we see food packaging, and we probably all use some variety of packaging at home to store our leftovers, and so it's really important to opt for things like ceramic and glass as opposed to plastic when you are storing, and particularly when you're reheating your food at home.
Thank you, Thomas. And Sue, this is incredible information, especially since so many of us are doing DoorDash and other kinds of things. We really need to figure out how to minimize the adverse impacts. We are getting really close to the end of our time. I wanted to ask one more question for Thomas or Sue. So how do we avoid phthalates in our food? Thomas, you want to jump in first?
Yes, I'm I'm going to have to look it up really quickly. I think it's recycling code number 3. I think it's PVC that often can contain phthalates. So one way to avoid food packaging that contains phthalates is to avoid that particular plastic that has that recycling code on it.
Right, I think you
Okay.
are. I think you are.
Perfect.
The PVC related plastics.
Okay, so we've got to read our labels. Thank you very,
Could
very
I
much.
make
Oh,
one more
please.
comment, Regina, on the last question about the takeout containers? I did want to say to folks that you know, there is a growing movement looking at reusables at a larger level, at even a regional level. And so we're really excited about the idea of having sort of infrastructure in cities to be able to have businesses share collection and washing capacity, so that people don't have to drag around their own reusable cup and their reusable container and all the utensils and all of that stuff. And that eventually, I think we will be seeing more options that places are going to be able to offer reusables for you to take with you and then drop off at different locations. So I just wanted to add that.
Oh, no, that's very important. Thank you for raising that. This has been a fantastic discussion. I don't know about the broader audience, but I know I'm learning so much. We will be sharing some follow-up resources and ways that you can take action in the coming days. And we thank each and every one of you for being here with us today. All of our panelists are rock stars, subject matter experts, and we need you all. We need you and your words and your vision and your share. So if you enjoyed this town hall, please consider supporting our work by texting GIVE to 510-288-3065 or by going to ceh.org/donate/. Thanks again to our speakers and our sponsors. We're going to wish you a wonderful day. And when the webinar is posted to our website, hopefully you will be able to share this with other people who missed this conversation. Thank you once again and have a wonderful day.